Welcome to Executive Order Watch.
The immigrants have arrived.
I know. I have the package.
Terminated from Par 1 participating in a federal health 2 care program or the state plan 3 for a 4 reason described in paragraph 5. 6. Qualifying individual. The 7-term qualifying individual means an individual under 21 years of age who is N9 rolled under the state plan. 11S. The term State 12 means one of the 50 states or the District 13 of Columbia. 14. CA 15 scenes 17, 18, 19, 21, 22, 23, 24, 25. Section 1902 of the Social Security Act is amended by inserting enrollment after screening. The subsection heading for Section 1902 of such act is amended by inserting E after S. Section 2107 of such act is amended by inserting enrollment after screening. 403. The amendments made by this section shall apply beginning on the date that is 2 years after the date of enactment of this act. SEC 44303. Delaying DH reductions. IG Section 1923 of the Social C5 Security Act is amended 6. Paragraph 7. In Clause 8. In the matter preceding subclause 9, by striking 2026 through 2028 and 10 inserting 2029 through 2031 and 11. In subclause by striking 12 period and 13. In clause by striking 2026-14 through 2028 and inserting 2029 through 15, 2031 and 16. In paragraph by striking 2027 and 17 inserting 2031. TDHA Section 1923 of the Social Security Act is amended 21. In the header by striking and insert 22ing and 23. By striking fiscal year 2025 and inserting 24 fiscal year 2028. 25. 404. SEC 44,304. Modifying update to the conversion FAC 1 tour under the Physician Fee Schedule 2 under the Medicare program. 3. Section 1848 of the Social Security Act is amended. 5. In paragraph 6. In subparagraph 7. In the first sentence by striking 8 and ending with 2025 and 9. By striking the second sentence, 10 and 11. In subparagraph by striking 14. By amending paragraph to read as full 15 lows, 16 you paid for 2026 and subsequent 17. The update to the single conversion factor 18 established in paragraph 19. For 2026 is 75% of the SEC 20 retirees estimate of the percentage increase in 21 the MEI for 22 the year and 23. For 2027 and each subsequent year is 24. 10% of the Secretary's estimate of the 25% increase in the MEI for the year. 26. 405. SEC 44,305. Modernizing and ensuring PBM accountability. Prescription drug plans. Section 1860D 12 of the Social Security Act is amended by adding at the end the following new subsection. RRPBM for plan years beginning on or after January 1st, 2028. Agreements with pharmacy benefit. Each contract entered into with a PDP sponsor under this part with respect to a prescription drug plan offered by such sponsor shall provide that any pharmacy benefit manager acting on behalf of such sponsor has a written agreement with the PDP sponsor under which the pharmacy benefit manager and any affiliates of such pharmacy benefit manager, as applicable, agree to meet the following requirements. 46. ICE is provided on behalf of any entity or individual in connection with the utilization of covered Part D drugs from any such entity or individual other than bona fide service fees subject to clauses in 1, 2, 3, 4, 5. Incentive payments. For the purposes of this subsection, an incentive payment paid by a PDP sponsor to a pharmacy benefit manager that is performing services on behalf of such sponsor shall be deemed a bona fide service fee. If such payment is a flat dollar amount, is consistent with fair market value, is related to services actually performed by the pharmacy benefit manager or affiliate of such pharmacy benefit manager on behalf of the PDP sponsor making such payment in connection with the utilization of covered Part D drugs, and 407 meets additional requirements, if any, as determined appropriate by the Secretary. See clarification on rebates and discounts used to lower costs for covered Part drugs. Rebates, discounts, and other price concessions received by a pharmacy benefit manager or an affiliate of a pharmacy benefit manager from manufacturers, even if such price concessions are calculated as a percentage of a drug's price, shall not be considered a violation of the requirements of clause if they are fully passed through to a PDP sponsor and are compliant with all regulatory and subregulatory requirements related to direct and indirect remuneration. For manufacturer rebates under this part, including in cases where a PDP sponsor is acting as a pharmacy benefit manager on behalf of a prescription drug plan offered by such PDP sponsor. Evaluation of remuneration. Components of subsets of remuneration arrangements, such as fees or other forms of compensation paid. 408. Two are retained by the pharmacy benefit manager or affiliate of such pharmacy benefit manager, as determined appropriate by the Secretary, between pharmacy benefit managers or affiliates of such pharmacy benefit managers, as applicable, and other entities involved in the dispensing or utilization of covered Part D drugs shall be subject to review by the Secretary, in consultation with the advice of the Inspector General of the Department of Health and Human Services, as determined appropriate by the Secretary. The Secretary, in consultation with the Office of the Inspector General, shall review whether remuneration under such arrangements is consistent with fair market value through reviews and assessments of such remuneration, as determined appropriate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25. The pharmacy benefit manager shall disgorge any remuneration paid to such pharmacy benefit manager or an affiliate of such pharmacy. 409. Benefit manager in violation of this sub-1 paragraph to the PDP sponsor. Additional requirements. 3. The pharmacy benefit manager shall enter into a written agree, 5. Meant with any affiliate of such FAR 6 Macy benefit manager, under which 7. The affiliate shall identify and disgorge 8. Any remuneration described in clause 9. To the pharmacy benefit manager, 10 and 11, 12, 13, 14, 15, 16, 17, 18. Transparency regarding Guerin 19 T's and cost performance evaluation 20. The pharmacy benefit manager shall 21 define, interpret, and apply in a 22 fully transparent and consistent manner, 23 for purposes of calculating or otherwise, 24 evaluating pharmacy benefit manager per 25. A test, subject to any requirements determined appropriate by the Secretary, that the pharmacy benefit manager has entered into a written agreement described in subclause with any relevant affiliate of the pharmacy benefit manager. 410. Performance against pricing guarantees or similar cost performance measurements related to rebates, discounts, price concessions, or net costs, terms such as generic drug, in a manner consistent with the definition of the term under Section 423.4 of Title 42, Code of Federal Regulations, or a successor regulation. Brand name drug, in a manner consistent with the definition of the term under Section 423.4 of Title 42, Code of Federal Regulations, or a successor regulation. Specialty drug rebate and discount. Identify any drugs, claims, or price concessions excluded from any pricing guarantee or other cost performance measure in a clear and consistent manner, and where a pricing guarantee or other cost performance measure is based on a pricing benchmark other than 411. Wholesale acquisition cost of a drug, calculate and provide a wholesale acquisition cost-based equivalent to the pricing guarantee or other cost performance measure. Provision of information. In general, not later than July 1st of each year. Beginning in 2028, the pharmacy benefit manager shall submit to the PDP sponsor and to the Secretary a report in accordance with this subparagraph, and shall make such report available to such sponsor at no cost to such sponsor in a format specified by the Secretary under paragraph. Each such report shall include, with respect to such PDP sponsor and each plan offered by such sponsor, the following information with respect to the previous plan year. 412. The number of plan enrollees for whom the drug was dispensed. The total number of prescription claims for the drug, and the total number of dosage units of the drug dispensed. 1, 2, 3, 4, 5, 6, 7, 8, 9, 9, 10, 11, 12, 13, 14, 16, 7, 17, 18, 19, 20, 21, 22, 23, 24, 25. The number of prescription claims described in item by each type of dispensing channel through which the drug was dispensed, including retail, mail order, specialty pharmacy, long-term care pharmacy, home infusion pharmacy, or other types of pharmacies or providers. The average wholesale acquisition cost, listed as cost per day supply, cost per dosage unit, and cost per typical course of treatment. The average wholesale price for the drug, listed as price. 413. Per day supply, price per dosage unit, and price per typical course of treatment. 1, 2, 3, 4, 5, 6, 7, 8, 9, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. The total out-of-pocket spending by plan enrollees on such drug after application of any benefits under the plan, including plan enrollee spending through co-payments, co-insurance, and deductibles. Total rebates paid by the manufacturer on the drug as reported under the detailed DIR report submitted by such sponsor to the Centers for Medicare and Medicaid Services. All other direct or indirect remuneration on the drug as reported under the detailed DIR report submitted by such sponsor to the Centers for Medicare and Medicaid Services. 414. The average pharmacy reimbursement amount paid by the plan for the drug in the aggregate and disaggregated by dispensing channel identified in item 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25. the average national average drug acquisition cost, and total manufacturer-derived revenue, inclusive of bona fide service fees, attributable to the drug and retained by the pharmacy benefit manager and any affiliate of such pharmacy benefit manager. In the case of a pharmacy benefit manager that has an affiliate that is a retail mail order or specialty pharmacy, with respect to drugs covered by such plan that were dispensed, the following information: the percentage of total prescriptions that were dispensed by pharmacies that are an 415 affiliate of the pharmacy benefit manager for each drug. The interquartile range of the total combined costs paid by the plan and plan enrollees. Per dosage unit, per course of treatment, per 30-day supply, and per 90-day supply for each drug dispensed by pharmacies that are not an affiliate of the pharmacy benefit manager and that are included in the pharmacy network of such plan. The interquartile range of the total combined costs paid by the plan and plan enrollees. Per dosage unit, per course of treatment, per 30-day supply, and per 90-day supply for each drug dispensed by pharmacies that are an affiliate of the pharmacy benefit manager and that are included in the pharmacy network of such plan. 416. The lowest total combined cost paid by the plan and plan enrollees. Per dosage unit, per course of treatment, per 30-day supply, and per 90-day supply for each drug that is available from any pharmacy included in the pharmacy network of such plan. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. The difference between the average acquisition cost of the affiliate, such as a pharmacy or other entity that acquires prescription drugs, that initially acquires the drug, and the amount reported under subclause for each drug. A list inclusive of the brand name, generic or non-proprietary name, and National Drug Code of covered Part D drugs subject to an agreement with a covered entity under Section 340B of the Public Health Service Act, for which the 417. Macy Benefit Manager or an affiliate of the Pharmacy Benefit Manager had a contract or other arrangement with such a covered entity in the service area of such plan. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24. Where a drug approved under Section 505 of the Federal Food, Drug, and Cosmetic Act is covered by the plan, the following information: a list of currently marketed generic drugs approved under Section 505 of the Federal Food, Drug, and Cosmetic Act pursuant to an application that references such listed drug that are not covered by the plan, are covered on the same formulary tier or a formulary tier typically associated with higher cost sharing than the listed drug, or are subject to utilization man. 418. Agement that the listed drug is not subject to. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. The estimated average beneficiary cost sharing under the plan for a 30-day supply of the listed drug. Where a generic drug listed under item is on a formulary tier typically associated with higher cost sharing than the listed drug. The estimated average cost sharing that a beneficiary would have paid for a 30-day supply of each of the generic drugs described in item, had the plan provided coverage for such drugs on the same formulary tier as the listed drug. A written justification for providing more favorable coverage of the listed drug than the generic drugs described in item. The number of currently marketed generic drugs. 419. Approved under Section 505 of 1, the Federal Food, Drug, and 2 Cosmetic Act, pursuant to an AP3 application that references such 4 listed drug. Where reference product 6 of the 7 Public Health Service Act is covered 8 by the plan, the following information. A list of currently 10 marketed biosimilar biological 11 products licensed under Section 12351 of the Public Health 13 Service Act pursuant to an APLI 14 cash-in that refers to such Ref 15 ERINS product that are not COVA 16 eared by the plan, are covered on 17 the same formulary tier or a 418 Mullary tier, typically associated 19 with higher cost sharing than the 20 reference product, or are subject 21 to utilization management that 22 the reference product is not sub 23 JEC 2. 24. 420. The estimated average beneficiary cost sharing under the plan for a 30-day supply of the reference product. 1, 2, 3, 4, 5, 6, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Where a biosimilar biological product listed under item is on a formulary tier, typically associated with higher cost sharing than the reference product. The estimated average cost sharing that a beneficiary would have paid for a 30-day supply of each of the biosimilar biological products described in item, had the plan provided coverage for such products on the same formulary tier as the reference product. A written justification for providing more favorable coverage of the reference product than the biosimilar biological product described in item. The number of currently marketed biosimilar 421. Logical products licensed under Section 351 of the Public Health Service Act, pursuant to an application that refers to such reference product. Total gross spending on covered Part D drugs by the plan net of rebates, fees, discounts, or other direct or indirect remuneration. The total amount retained by the pharmacy benefit manager or an affiliate of such pharmacy benefit manager in revenue related to utilization of covered Part D drugs under that plan inclusive of bona fide service fees. The total spending covered Part D drugs net of rebates, fees, discounts, or other direct and indirect remuneration by the plan. An explanation of any benefit design parameters under such plan that encourage plan enrollees to fill prescriptions at pharmacies that are an affiliate of such pharmacy ben. 422. Fit manager such as mail and specialty home delivery programs and retail and mail auto refill programs. 1, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25. The following information: a list of all brokers, consultants, advisors, and auditors that receive compensation from the pharmacy benefit manager or an affiliate of such pharmacy benefit manager for referrals, consulting, auditing, or other services offered to PDP sponsors related to pharmacy benefit management services. The amount of compensation provided by such pharmacy benefit manager or affiliate to each such broker, consultant, advisor, and auditor. The methodology for calculating the amount of compensation provided by such pharmacy benefit manager or affiliate for each such broker, consultant, advisor, and auditor. 423. A list of all affiliates of the one pharmacy benefit manager. A summary document sub 3 minted in a standardized template developed by the secretary that includes 5 such information described in sub 6 clauses through 7 written explanation of Con 8 tracks or agreements with Drug 9. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. In general, the pharmacy benefit manager shall not later than 30 days after the finalization of any contract or agreement between such pharmacy benefit manager or an affiliate of such pharmacy benefit manager and a drug manufacturer that makes rebates, discounts, payments, or other financial incentives related to one or more covered Part D drugs or other prescription drugs as applicable of the manufacturer directly or indirectly contingent upon coverage. 424. Formulary placement or utilization management conditions on any other covered Part D drugs or other prescription drugs as applicable. Submit to the PDP sponsor a written explanation of such contract or agreement. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. R. A written explanation under subclause shall include the manufacturer subject to the contract or agreement. All covered Part D drugs and other prescription drugs as applicable subject to the contract or agreement and the manufacturers of such drugs, and a high-level description of the terms of contract or agreement and how such terms apply to such drugs. Be certified by the Chief Executive Officer, Chief Financial Officer, or General Counsel of such pharmacy benefit manager or affiliate of such. 425. Pharmacy benefit manager, as applicable, or an individual delegated with the authority to sign on behalf of one of these officers, who reports directly to the officer. Definition of other prescription drugs. For purposes of this clause, the term other prescription drugs means prescription drugs covered as supplemental benefits under this part, or prescription drugs paid outside of this part. I, not less than once a year, at the request of the PDP sponsor. The pharmacy benefit manager shall allow for an audit of the pharmacy benefit manager to ensure compliance with all terms and conditions under the written agreement described in this paragraph and the accuracy of information reported under subparagraph. A. The PDP sponsor shall have the right to select an auditor. 426. The pharmacy benefit manager shall not impose any limitations on the selection of such auditor. Provision of information. The pharmacy benefit manager shall make available to such auditor all records, data, contracts, and other information necessary to confirm the accuracy of information provided under subparagraph, subject to reasonable restrictions on how such information must be reported to prevent redisclosure of such information. The pharmacy benefit manager must provide information under clause and other information, data, and records relevant to the audit to such auditor within 6 months of the initiation of the audit and respond to requests for additional information from such auditor within 30 days after the request for additional information. Information from affiliate. The pharmacy benefit manager shall be responsible for providing to such auditor information required to be reported. 427. Under subparagraph or under clause 1 of this subparagraph that is owned or 2, held by an affiliate of such pharmacy Ben 3 IFIT manager. Each Piancer 667. Disgorge to the Secretary any aid amounts disgorged to the PDP sponsor by 9, a pharmacy benefit manager under para 10 graph. 11. Require, in a written agreement 12, with any pharmacy benefit manager acting 13 on behalf of such sponsor or affiliate of 14 such pharmacy benefit manager, that such 15 pharmacy benefit manager or affiliate re-16 reimburse the PDP sponsor for any civil sane money penalty imposed on the PDP spawn 18, or as a result of the failure of the FAR 19 Macy benefit manager or affiliate to meet 20, the requirements of paragraph that are 21 applicable to the pharmacy benefit man 22 ager or affiliate under the agreement, and 23 require, in a written agreement 24 with any such pharmacy benefit manager 25. 428. Acting on behalf of such sponsor or affiliate of such pharmacy benefit manager. that such pharmacy benefit manager or affiliate be subject to punitive remedies for breach of contract for failure to comply with the requirements applicable under paragraph. Reporting of alleged viola. The Secretary shall make available and maintain a mechanism for manufacturers, PDP sponsors, pharmacies, and other entities that have contractual relationships with pharmacy benefit managers or affiliates of such pharmacy benefit managers to report on a confidential basis alleged violations of paragraph or subparagraph. A. Retaliation and ante. Consistent with applicable federal or state law, a PDP sponsor shall not retaliate against an individual or entity for reporting an alleged violation under subparagraph, or coerce, intimidate, threaten, or interfere with the ability of an individual. 429. Or entity to report such alleged violations. Certification of compliance. I. In general, each PDP sponsor shall furnish to the Secretary an annual certification of compliance with this subsection, as well as such information as the Secretary determines necessary to carry out this subsection. I. The Secretary may implement this paragraph by program instruction or otherwise. R. Rule of construction. Nothing in this subsection shall be construed as prohibiting flat dispensing fees or reimbursement or payment for ingredient costs to entities that acquire or dispense prescription drugs, modifying regulatory requirements or sub-regulatory program instruction or guidance related to pharmacy payment, reimbursement, or dispensing fees. 430. I. In general, not later than June 1st, 2027, the Secretary shall specify standard, machine-readable formats for pharmacy benefit managers to submit annual reports required under paragraph. The Secretary may implement this paragraph by program, instruction, or otherwise. I. In general, information disclosed by a pharmacy benefit manager, an affiliate of a pharmacy benefit manager, a PDP sponsor, or a pharmacy under this subsection that is not otherwise publicly available or available for purchase shall not be disclosed by the Secretary or a PDP sponsor receiving the information, except that the Secretary may disclose the information for the following purposes. As the Secretary determines necessary to carry out this part, to permit the Comptroller General to review the information provided, to permit the Executive Director of the Medicare Payment Advisory. 431. Commission to review the information provided to the Inspector General of the Department of Health and Human Services in accordance with its authorities under the Inspector General Act of 1978 and other applicable statutes. Our restriction on use of Informa. The Secretary, the Comptroller General, and the Executive Director of the Medicare Payment Advisory Commission shall not report on or disclose information disclosed pursuant to subparagraph to the public in a manner that would identify a specific pharmacy benefit manager, affiliate, pharmacy, manufacturer, wholesaler, PDP sponsor, or plan, or contract prices, rebates, discounts, or other remuneration for specific drugs in a manner that may allow the 432. A. The term affiliate means with respect to any pharmacy manager or PDP sponsor, any entity that directly or indirectly owns or is owned by, controls or is controlled by, or is otherwise related in any ownership structure to such pharmacy benefit manager or PDP sponsor, or acts as a contractor, principal, or agent to such pharmacy benefit manager or PDP sponsor insofar as such contractor, principal, or agent performs any of the functions described under subparagraph. Bona fide service fee. The term bona fide service fee means a fee that is reflective of the fair market value for a bona fide, itemized service actually performed on behalf of an entity that the entity would otherwise perform. 433. In the absence of the service arrangement, and that is not passed on in whole or in part to a client or customer, whether or not the entity takes title to the drug. Such fee must be a flat dollar amount and shall not be directly or indirectly based on or contingent upon drug price, such as wholesale acquisition cost or drug benchmark price. The amount of discounts, rebates, fees, or other direct or indirect remuneration with respect to covered Part D drugs dispensed to enrollees in a prescription drug plan, except as permitted pursuant to paragraph. Coverage or formulary placement decisions, or the volume or value of any referrals or business generated between the parties to the arrangement, or any other amounts or methodologies prohibited by the Secretary. Pharmacy Benefit Manager. The term pharmacy benefit manager means any person or entity that, either directly or through an intermediary, acts as a price negotiator. 434. Group purchaser on behalf of a PDP sponsor or prescription drug plan, or manages the prescription drug benefits provided by such sponsor or plan, including the processing and payment of claims for prescription drugs, the performance of drug utilization review, the processing of drug prior authorization requests, the adjudication of appeals or grievances related to the prescription drug benefit, contracting with network pharmacies, controlling the cost of covered Part D drugs, or the provision of related services. Such term includes any person or entity that carries out one or more of the activities described in the preceding sentence, irrespective of whether such person or entity calls itself a pharmacy benefit manager. MAPD, Section 1857 of the Social Security Act, is amended by adding at the end the following new subparagraph. Requirements relating to pharmacy benefit managers for plan years beginning on or after January 1st, 2028, Section 1860D, 12. 435. And on application of Paperwork Reduction Act. Chapter 35 of Title 44 United States Code shall not apply to the implementation of this subsection. S. In addition to amounts otherwise available, there is appropriated to the Centers for Medicare and Medicaid Services Program Management account, out of any money in the Treasury not otherwise appropriated, $113 million for fiscal year 2025 to remain available until expended to carry out this subsection. OIG, in addition to amounts otherwise available, there is appropriated to the Inspector General of the Department of Health and Human Services, out of any money in the Treasury not otherwise appropriated, $20 million for fiscal year 2025 to remain available until expended to carry out this subsection. Patport W20P NWRP 3DP 24. 436. The Medicare Payment Advisory Commission shall submit to Congress the following reports. I, not later than the first March 15th occurring after the date that is 2 years after the date on which the Secretary makes the data available to the Commission, a report regarding agreements with pharmacy benefit managers with respect to prescription drug plans and MAPD plans. Such reports shall include, to the extent practicable, a description of trends and patterns, including relevant averages, totals, and other figures for the types of information submitted. An analysis of any differences in agreements and their effects on plan enrollee out-of-pocket spending and average pharmacy reimbursement, and other impacts. Any recommendations the Commission determines appropriate. And all report, not later than 2 years after the date on which the Commission submits the initial report under subparagraph 437. A report describing any changes with respect to the information described in subparagraph over time, together with any recommendations the Commission determines appropriate. F. In addition to amounts otherwise available, there is appropriated to the Medicare Payment Advisory Commission, out of any money in the Treasury not otherwise appropriated, $1 million for fiscal year 2026 to remain available until expended to carry out this subsection. Title V, Committee on Financial Services. Seeks $50,001, Green and Resilient Retrofit Program for Multifamily Family Housing. The unobligated balance of amounts made available under Section 30002 of Pub Law 117 to 169 are rescinded. C. 50,002, Public Company Accounting Oversight Board. During the period beginning on the date of enactment of this Act and ending on the transfer date, all intellectual property retained by the Public Company Accounting Oversight Board. 438. In support of its programs for registration, standard setting, and inspection shall be shared with the Securities and Exchange Commission. Pending enforcement and disciplinary actions of the Board shall be referred to the Commission or another federal functional regulator in accordance with Section 105 of the Sarbanes-Oxley Act of 2002. Effective on the transfer date, all unobligated fees collected under Section 109 of the Sarbanes-Oxley Act of 2002 shall be transferred to the General Fund of the Treasury, and the Commission may not collect fees under such Section 109. The duties and powers of the Board in effect as of the day before the transfer date, other than those described in Section 107 of the Sarbanes-Oxley Act of 2002, shall be transferred to the Commission. The Commission may not use funds to carry out Section 107 of the Sarbanes-Oxley Act of 2002 for activities related to overseeing the Board. 439. The Board shall transfer all intellectual property described in subsection to the Commission. Existing processes and regulations of the Board, including existing Board auditing standards, shall continue in effect unless modified through rulemaking by the Commission. In connection with the duties and powers transferred under paragraph, any reference to the Board in any law implemented by a federal functional regulator, in any rule or guidance issued by a federal functional regulator, or in any records or other documents in the possession of a federal functional regulator, shall be deemed a reference to the Commission. Any employee of the Board as of the date of enactment of this Act may be offered equivalent positions on the Commission staff as determined by the Commission and submit to the Commission's standard employment policies. And 440. Receive pay that is not higher than the highest paid employee of similarly situated employees of the Commission. In this section, the term transfer date means for the date established by the Commission for purposes of 5. This section, except that such date may not be later than 6. The date that is 1 year after the date of enactment of this 7 Act. This is 50,003, Bureau of Consumer Financial Protection. Section 1017 of the Consumer Financial Pro 11 Protection Act of 2010 is amended. In subparagraph 13, by striking 12% and inserting 14. 5%, 15, by striking 2013 and inserting 16, 2025, 17, by striking subparagraph and inserting 18, the following. Imitation on obligated BAL. 20. With respect to a fiscal year. 21. Amount of unobligated balances of the Bureau. 22. May not exceed 5% of the dollar amount. 23. Referred to in subparagraph as adjusted. 24. Under subparagraph. The director shall. 25. For date November 24th, 2008, 2138 May 18th, 2025 JT00000 PO 0000 FFRM 0440 MD 662 SF6201C. User RP Johnson. App data roaming softquad X metal 11.GRCP 11. May 18th, 2025. CMT MSCP 193. GVF 0582505182505 441. Transfer any excess amount of such unobligated one balances to the general fund of the Treasury. C 50,004. Consumer Financial Civil Penalty Fund. Section 1017 of the Consumer Financial Protection Act of 2010 is amended. In paragraph. In the first sentence by inserting direct before victims. By striking the second sentence. By adding at the end the following. Treatment of excess amounts. With respect to a civil penalty described under paragraph. If the Bureau makes payments to all of the direct victims of activities for which that civil penalty was imposed, the Bureau shall transfer all amounts that remain in the Civil Penalty Fund with respect to that civil penalty to the General Fund of the Treasury. CC 50,005 Financial Research Fund. Section 155 of the Financial Stability Act of 2010-20 is amended by adding at the end the 21 following 22L assessments and the F23RF 24 442 L imitation on assessments. Assessments may not be collected under subsection if the assessments would result in the financial research fund exceeding the average annual budget amount, or the total assessments collected during a single fiscal year exceeding the average annual budget amount, transfer of excess funds. Any amounts in the financial research fund exceeding the average annual budget amount shall be deposited into the general fund of the Treasury. Average annual budget amount D. In this subsection, the term average annual budget amount means the annual average over the 3 most recently completed fiscal years of the expenses of the Council in carrying out the duties and responsibilities of the Council that were paid by the office using amounts obtained through assessments under subsection 443. Title Statute Committee on Homeland Security 2 Sec. 6001. Border Barrier System Construction, 3 Invasive Species and Border Security 4 Facilities Improvements. In addition to amounts otherwise available. There is 6 appropriated to the Commissioner of U.S. Customs and 7 Border Protection for fiscal year 2025, out of any money 8 in the Treasury not otherwise appropriated, to remain 9 available until September 30th, 2029, the following, 10. $46,500,000,000 for necessary expenses, re-11 relating to the following, 12. Construction, installation, or improve 13 men of primary, waterborne, and secondary 14 barriers. 15. Access road 16. Barrier system attributes, including 17 cameras, lights, sensors, roads, and other detect, 18 Shin technology. 19. $50 million for necessary expenses relating 20 to eradication and removal of the Carrizo cane plant, 21 salt cedar, or any other invasive plant species that 22 impedes border security operations along the Rio 23 Grande River. 24. 444. $5 billion for necessary expenses, -1 rupee relating to lease, acquisition, construction, or improved 2 men of U.S. Customs and Border Protection Facility, 3 ties and checkpoints in the vicinity of the Southwest, 4 northern and maritime borders. 5S6002, U.S. Custom Border Protection per 6 Sunnel and Fleet vehicles. CBPP, in addition to amounts otherwise available. There is appropriated to the Commerce 9 Cyanor of U.S. Customs and Border Protection for fiscal 10 year 2025. Out of any money in the Treasury not otherwise 11 appropriated, $4,100,000,000 to remain available until September 12, 30, 2029 to hire and train additional Border 13 patrol agents, Office of Field Operations officers, Air and 14 Marine agents, rehired annuitants, and U.S. Customs and 15 Border Protection support personnel. Are none of the funds made avail, 17 able by subsection may be used to recruit, hire, or train 18 personnel for the duties of processing coordinators. 19. CBPRHB and add 20 addition to amounts otherwise available. There is a Pro 21 priated to the Commissioner of U.S. Customs and Border 22 Protection for fiscal year 2025. Out of any money in the 23 Treasury not otherwise appropriated, $2,052,630,000 to 24 remain available until September 30th, 2029 to provide 25. 445. Dual retention bonuses or signing bonuses to eligible Borwonder patrol agents, Office of Field Operations officers, and 2 Air and Marine agents. 3 CBPV in addition to amounts other 4Ys available. There is appropriated to the Commissioner 5 of U.S. Customs and Border Protection for fiscal year 6, 2025. Out of any money in the Treasury not otherwise up 7 appropriated, $813 million to remain available until September 8, 30, 2029 for the lease or acquisition of additional 9 marked patrol units. 10, 16, 17, 18, 19, 20, 21, 22, 23, 24. Let's see. In addition to amounts otherwise available 11 able, there is appropriated to the Director of the Federal 12 Law Enforcement Training Center for fiscal year 2025, 13 out of any money in the Treasury not otherwise a Pro 14 priated 15. $285 million to remain available until September 30th, 2029 to support the training of newly hired federal law enforcement personnel employed by the Department of Homeland Security, and $465 million to remain available until September 30th, 2029 for procurement and construction, improvements, and related expenses of the Federal Law Enforcement Training Center's facilities. 446. PSWR-1AS in addition to amounts up to or wise available. There is appropriated to the Commerce 3 Cyanor of U.S. Customs and Border Protection for fiscal 4 year 2025. Out of any money in the Treasury not otherwise 5 appropriated, $600 million to remain available until September 6th, 30, 2029 for marketing, recruiting, applicant 7 sourcing and vetting, and operational mobility programs, 8 for border security personnel. SEC 60,003, U.S. Customs and Border Protection 10 technology, vetting activities, and 11 other efforts to enhance border say 1213 CBPT. In addition to amounts of 14 or wise available. There is appropriated to the Commissar 15 signer of U.S. Customs and Border Protection for fiscal 16 year 2025. Out of any money in the Treasury not otherwise 17 appropriated to remain available until September 30th, 2029, the following: 19, 20, 21, 22, 23, 24. $1,076,317,000 for necessary expenses relating to procurement and integration of new non-intrusive inspection equipment and associated civil works, artificial intelligence integration and machine learning, as well as other mission support to 447. Combat the entry of illicit narcotics along the South 1 West, Northern, and Maritime borders. $2,766,000,000 for necessary expenses relating to upgrades and procurement of border surveillance technologies along the Southwest, Northern 5, and Maritime borders. $673 million for necessary expenses in 7, including the deployment of technology relating to the 8 biometric entry and X system under Section 72089 of the Intelligence Reform and Terrorism Prevention 10 Act of 2004. 11. None of the funds made avail 12 able pursuant to section may be used for the 13 procurement or deployment of surveillance towers that 14 have not been 15 tested and 16 accepted, 17 by the federal government to deliver autonomous Kappa 18 abilities. 19. AMO, in addition to 20 amounts otherwise available. There is appropriated to the 21 Commissioner of U.S. Customs and Border Protection for 22 fiscal year 2025. Out of any money in the Treasury not 23 otherwise appropriated, $1,234,000,000 to remain avail, 24 able until September 30th, 2029 for Air and Marine OPER 25. 448. Asians upgrading and procurement of new platforms for 1 rapid air and marine response capabilities. CBPVA, in addition to 3 amounts otherwise available. There is appropriated to the 4 Commissioner of U.S. Customs and Border Protection for 5 fiscal year 2025. Out of any money in the Treasury not 6 otherwise appropriated. $16 million to remain available 7 until September 30th, 2029 for necessary expenses to sub-8 port screening, vetting activities and expansion of U.S. 9 Customs and Border Protection's criminal history data 10 bases. To C-12BBS. In addition, 13 to amounts otherwise available. There is appropriated to 14 the Secretary of Homeland Security for fiscal year 2025. 15 out of any money in the Treasury not otherwise priated. $500 million to remain available until September 17, September 30, 2029 for enhancing border security and COM-18 batting trafficking, including fentanyl and its precursor 19 chemicals at the Southwest, Northern, and Maritime Board 20 DERS. 21. C. In addition to amounts of 22 otherwise available. There is appropriated to the Secretary of 23 Homeland Security for fiscal year 2025 out of any money 24 in the Treasury not otherwise appropriated $1 million.
Welcome to Executive Order Watch.
The immigrants have arrived.
I know. I have the package.